Ladies and gentlemen, with that note, now we move on to our next panel discussion, the health tech founder perspective, building health tech that actually gets used. Innovation in healthcare is not just about building a product, a great product. The real challenge lies in adoption, trust, accessibility, and scaling solutions that work in the real world. And this panel bring together the founders who are building solutions across AI, medical devices, pediatric healthcare, patient engagement, and medtech. And leading this conversation is our moderator. Please put your hands together and join me in welcoming Dr. Karan Suresh. A big round of applause from MediBuddy. A very warm welcome to you, sir. Dr. Karan works at an intersection of clinical data, AI, digital health, and healthcare strategy, translating unstructured data into actionable clinical insights and driving innovation across diverse healthcare use cases. Joining him on the panel are Dr. Anand Sivaraman, a round of applause, everybody, from Remedio, who's reimagining healthcare access through AI-powered medical devices and bringing specialist diagnostics closer to primary care and the last mile. A round of applause as we welcome Dr. Anand Sivaraman. A very warm welcome to you, sir. And please put your hands together and join me in welcoming our next esteemed panelist. We have Smita Malipatil. A round of applause. Smita Malipatil, founder and CEO of Hosa Health, building a pediatric intelligence layer for Gen Alpha healthcare with deep experience in AI, deep tech, entrepreneurship, and responsible AI. So with that, ladies and gentlemen, we are going to welcome our next panelist. We have Mr. Raghuvamshi Thakur, co-founder of Product AI. A big round of applause as we welcome him. Transforming patient care through conversational and agentic AI, helping healthcare providers automate and personalize patient journeys. So we have our next panelist. Please put your hands together for Mr. Pradeep Vamana, co-founder of Prudency. A big round of applause as we welcome him. Building affordable medtech solution for smarter orthopedic care and bringing a strong perspective and taking medical devices from concept to the operating room. And ladies and gentlemen, together they bring a wealth of experience, what it truly takes to move from innovation to adoption, from idea to product, and from a product to a meaningful impact at scale. So over to Dr. Karan. Over to you, sir.
Yes, thank you so much. Good afternoon, ladies and gentlemen. It's a pleasure to have you all. Such an eclectic mix here today. We have Anand sir from Remedio, who is so proficient in oculomics. Smita ma'am from Hosa Health. Raghuvamshi sir from Product AI, as we saw in the morning. And Pradeep sir from Prudency. So we'll start off with Dr. Anand. So, fundus on phone. So many different oculomics modalities that you've been working on, right? In general, health tech is often spoke about as one industry, but building a diagnostic medical device that you previously worked on is fundamentally different from building another product in the medical category, right? How should founders decide which problem is worth solving, knowing that each one comes with a very different regulatory and commercial journey?
Thanks so much. You sort of feel very old when you're addressed as sir. But to a large extent, I think coming back to the question, I think at the end of the day, I feel that someone who starts off a company or founds a company, there are those who have a purpose behind why they do what they do, and there would be those who have a purpose which is more aligned to, let's say, the business side of things as well. So it's going all the way from mission to, let's say, the purpose being driven by business. When we got started, for me, it was about a purpose led by a mission. So therefore, whether the technology element, where we said we wanted to prevent blindness, we said if tomorrow we had to build a medical device, we'll do that. If tomorrow we need to build SAMD AI algorithms, we will do that. If we need to get into service delivery, we will do that. Because at the end of the day, the goal was about preventing blindness. And when we moved into oculomics, it was about taking what we said about preventing blindness to saying how do you prevent death, or how do you prevent mortality or morbidity as a result of systemic diseases. So it was an extension of that. From a founder's perspective, I think first is about staying true. I mean, usual answer would be where the market size is big, etc. But I'm going to tell you that you're going to be spending a lot of time doing what you're going to be doing. So it should be something that you relate with, and it's something that as a journey you feel very confident about, that the time that you're spending is well worth the time, because there's a deeper meaning behind why you do what you do. The business side is, of course, very important in terms of what everyone would talk about as stamp, sum, and sum. That, I guess, is important. But between the scalability of a business, as many would say, is devices, especially if it's a one-time, is not going to be as easily scalable or investable as opposed to, let's say, recurring revenue businesses. So to a certain extent, I think I would therefore conclude by saying, one, follow your passion, then figure out the right model to make it big. When we got started in ophthalmology, we were told, and rightly so, that it's a very niche market. We ended up actually making the market bigger by increasing the number of touch points. So for us, it's about following a passion and then saying, how do I make the market bigger? For others, it would be about looking at the market and then answering the question from a business perspective. But broadly, I would say these two would be how you'd want to dice the question.
Thank you so much. And personally speaking, blindness is something very personal to my cause as well in terms of solving. So very lovely to see what you do. We'll move on to Raghvamshi sir, who had spoke about ProDoc AI in the morning. Very interesting things that you were doing in Agentic AI. With regard to that, I have a question to ask you, of course. AI is only good as the data behind it. In India, fragmented patient records and limited longitudinal data create unique challenges. How has this shaped the way you've built ProDoc AI, and what should founders keep in mind when designing AI products for the Indian healthcare system?
All right, thank you for the question. And what you mentioned is precisely the reality out there, right? When we started off, we didn't know that, we knew that there was a problem with respect to data. We didn't know the extent to which it was. Right? And I concur toward that once you put a goal towards which you want to move, you pretty much figure out a way to get there, right? And in that journey, you do things which would probably be seen as hindrance to how do you solve that, right? So that's what we've been doing. We've been trying to see different touch points in terms of where we can actually automate so that we actually supplement enough data to get there, right? But generally, because the last panel which talked about radiology quite a bit, right? I just want to also point this out to every entrepreneur out there. There's something called AI Kosh, which actually Government of India has set up. It does have, or it's starting to have contributions from a lot of different organizations in terms of data to solve that problem. I would highly encourage hospitals as well to start seeing that as a way to contribute to a larger goal. Right? If we are serious about building models for India, we need data. And there is no better way to make that data anonymized and be available to everybody out there so that the innovation can really thrive. And so that's pretty much for myself.
Thank you so much for that. Moving on to Smita ma'am. Again, very impressive stuff with what you've done. You've worked in a whole bunch of markets, right? You understand US healthcare markets before. You've started companies in the UK. Now moving on to a product as niche and interesting as pediatric healthcare in India. Parents today have more access to health information than ever before, yet they often feel quite overwhelmed, right? And that's fairly reasonable as well. How can we make AI make healthcare decisions clearer without creating more anxiety?
Very, very interesting question. Obviously, the abundance of information out there doesn't make life easier. In fact, if you were to ask me, because there's so much information out there, most parents are actually overwhelmed, right? So I'm a parent twice over, and every time I've spent time Googling or ChatGPTing. Now ChatGPT is slightly better, but every time I've Googled for information, I've got everything from a skin rash to skin cancer for my child in the same list results. So an abundance of information is good, but it doesn't necessarily mean it solves a problem. I think where we're seeing technology evolving, luckily for us parents and for consumers of healthcare information on the internet, is the fact that you need to start helping the triaging of information, right? On two parts. One is you're easing the anxiety of the parents, because me being worried about my child's rash versus being alarmed at the child's possibility of skin cancer, to actually, you know what, it's not that, give me more information, which is where conversational AI is going, I think starts to narrow down the anxiety, and AI needs to kind of act more like a senior nurse. I think this was referred to in the earlier conversations. I don't think AI is at a level where we're looking at replacing doctors. I think we're looking at them assisting and doing a triage sort of a move in technology. And that's where, I decided to focus my efforts on pediatric health. I discovered that despite the abundance of information out there, a lot of that information was either based on models that didn't reflect the regionality and the ethnicity. It didn't reflect in actually helping me narrow down the problem, gave me more anxiety. So can we try and do something to address this issue? Gen Alpha comes with a lot more issues. They've grown up with technology. There's a lot more cognitive issues that have come as a result. There's a lot of mental health issues as well. So can we work healthcare systems, redesign it, create a new, hence Hosa Health, new way of looking at children's healthcare in a way where proactive health becomes part of how they grow up as opposed to reactive health, which is the kind of system we are in today.
Lovely. The choice paradox can really be a terrible thing sometimes, and I'm glad you're finding your own ways to solve that. Moving on to Pradeep, sir. I have entered a surgical, like an operation theater before, and even we being interns, they didn't let us in, right? Sometimes. It's so impressive that you've gotten your product into these OTs, 35,000 replacement surgeries over, right? Across 150 hospitals. In surgery, clinicians simply cannot afford to take chances with a new product. What did it take to earn that level of trust, and what lessons can other health tech founders learn about building credibility in clinical environments?
Thanks for the question and thanks for the opportunity here. It's an awesome conference here. So I've learned the hard way in my previous role as a business development manager that building trust requires time and work. In my last role, it took me 2 years to get my first sales opportunity. So that really helped. That hard way of learning helped here. In here, we built, trust is built over a period of time. It is compounded. It's never, at 35,000 did not happen overnight. So the way we worked is we have in our company 2 co-founders, myself and my co-founder, and he takes care of the technical side, I take care of the sales side. He had an obsession for the problem and the product, whereas I had the obsession for the problem and the user. When we took the product to the market, what we did was to not focus on large hospitals, but we focused on hospitals that is owned by the orthopedic surgeons, a small 50-bedded hospital that would give us direct feedback. And it so happened that in Mumbai, they would give us direct feedback saying that A tik nahi hai, O tik nahi hai. And we would respond to them very immediately with a better product, with fixing those issues and making that sale, right? And bit by bit, one by one, we got to 100 surgeons level. At that point, we started to focus on larger hospitals, even still there, not the corporate hospitals. We scaled it to about 250, then focused on the corporate hospitals and then the government hospitals. So it built bit by bit. And I think in hindsight, if I would present that as a strategy, that would be awesome. But unfortunately, it was not strategy. It was based on need to get a feedback, an accurate feedback fast, and so that we can close the deal and put the lights on, right? So that as simple as that. But if I were to present it as strategy, it's actually a good strategy. I would definitely reapply that.
That's nice to hear. India has huge hospitals with dedicated IT teams, with informatics officers, but there's 70,000 or more smaller clinics and hospitals that need, where trust and credibility forms the base layer. So I'm glad you're tapping into that really. So I have a question that I want to throw open to all the panelists out here. If you were starting, and this is especially true for somebody young, just like myself and all of us over here really, if you were starting your company again in 2026 with everything you know today, what would you do differently and what would you absolutely do the same? We'll start off with Raghuvamshi sir, please.
Go for it.
All of y'all, please.
So one thing that I would probably do exactly the same is the way we approach the problem and the way we went out to a market. So what we actually did was we contacted few of our batchmates. Who were, so we come, me and my co-founder, we both come from Sainik School. So what we did was we reached out to our batchmates and identified 4 or 5 doctors. And we literally spent the first 6 months just sitting with them and primarily throwing it back and forth in terms of, does this really seem like a problem or not, right? It was very important for us to know that it's not just a thing that we're trying to build only because we think that it's a gap. And these doctors were also the decision makers, they also were the hospital owners. So it was also important to see that these doctors also see financial viability and business interest in part of it, not just the part of doing it for. Right? Because a lot of time what happens is we meet doctors, the doctor is very excited about something, but then the management is not, right? So, and then there is a conflict of interest that goes on there. So we did that. I think that is a great idea. Reach out to the closest network. Those are the ones who will probably let you do some mistakes and let you try solution and get better from there. What I would do differently is primarily we actually went to try it. So we had this whole notion of, in India, the understanding of health and health literacy is fairly low in rural areas. Right? So we jumped onto this whole idea that we would actually implement the whole solution in a tier 2 town first. Right? And I think that was a mistake because tier 2 town, the availability of healthcare is so scarce that it really doesn't matter the channel. Right? They're not interested in the education part, they're interested in the treatment part to begin with. Right? So whether they are, nobody takes an appointment, nobody cares about the reports. Somebody said this very truly. Pretty much everybody takes a photo of their report and put it on WhatsApp and ask 10 doctors as to what they want, right? So data privacy is a myth. And I don't think a lot of us take it very seriously, right? A 5 rupee coupon and most of us will probably give out our financial data free. Right? We don't really take a lot of in terms of that. That was something that was a mistake because we spent a lot of time trying to understand that market and then realized that it would have been way easier for us to position the same product in a tier 1 market. It's just a learning, but in the process of doing that, we did learn a lot of other things that makes what we offer today. But yeah, that's our journey.
I'll start with what I would recommend doing. Doing the same way is, first of all, identify the problem statement, and ideally a problem statement that the market's willing to pay for, rather than I have a solution, so let me find a problem to fit around it. So with my first company and the second one, we launched fast. We found the right problem statement, launched fast, and went ahead with it. In hindsight, what would I change about how I did my first company? I would actually, as a founder, give myself dedicated days in a month where you're only focused on looking outside of the company for growth and expansion. We were doing that. We had a sales team, we were selling. Eventually, everything worked out well because we've identified the right problem, we had good customers, we got acquired, got listed, all of that. But if I had to go back and do it again, I'd be like, I'd spend less time doing ops. I don't know if you'll find yourself in that problem, right? So every time you see a problem, you want to solve it, and you want to solve it yourself. So spend less time doing ops and spend more time looking out. Get a good team who can solve the ops for you.
Definitely, problem is the key. But I would just want to take problem ownership in more detail. When I started with this particular company, I spent a lot of time to learn joint replacement surgery. I had the opportunity to be in about 100 surgeries. I would definitely do the same thing. If I were to do something else, I will, like other fields, I'll definitely spend a lot of time with the doctors, with the specialists, understand the problem, go as much as deep as I can, then start to look at building a product. But I would probably do differently would be, as medical device entrepreneurs or any innovators, we think our product is the best and has never been created. Often it is not true. Because there is almost a 80% problem, solution out there. I think it's best to probably take that product out of the market, find a way to promote that product to the same customer, and by doing that, you will cut short the development cycle significantly and understand again the problem in more deeper front, and probably you can get more insights to what you can. Plus generate a revenue model. So I would probably do that in my next product.
Great.
Yeah.
So I think I'll cover some things we may not have covered. I think a lot on the customer, product, and need was covered. If I keep it strategically, things that we would do the same if I were to start another startup right now is healthcare being a credibility and brand-driven business. One of the things that I think we don't do well in the Indian ecosystem, but I think we did well, was clinical publications, peer-reviewed literature. For example, we had publications in Nature, Science, and others, which resulted in credibility outside India. And I think I would do that again. So we had 100 plus publications. So that's very, very important. Second is India for India versus India for the world, right? And I think one of the things that I felt we didn't do right is we ended up selling for around 6-7 years in India before we went outside India. We sold, and the revenues we made in 2 years in the US was equal to what we did in 7 years in India. So I think it's very important to go outside first and faster. And the interesting effect of that is sales in India picks up once outside India sales picks up. The reason is there is always the credibility that people watch out for, including doctors saying, "Arey, US mein bik raha hai, to acha hoga." So you need to keep in mind the fact that look at a global market. The last thing which I would have done differently is go outside first and go faster, as opposed to necessarily, because you're going to go after the early adopter market for a new differentiated product, and that's not a very large pool. We are risk averse. We have to accept that India healthcare system is risk averse, and therefore it's okay to look at a larger pool outside India as well. The last thing I would do is we think we did it right. I got it wrong in the first startup. I think the second startup we got it right is at different stages of the company, choose the right investors. Very early, trying to bring in someone who's looking at a return on investment when the product possibly is not even established a product market fit would not make sense. So I think that's the last point I would focus on. Choosing the right type of investors depending upon the stage at which you may be in terms of the growth journey or the development journey or the monetization journey.
Even with Dario's speech in the morning, when I saw the funding difference 2026 YTD, 20 billion versus 260 million, it's insane. So I think that fully adds up to what he was saying as well. Fantastic. One last question, again, thrown open for all of y'all. What's one assumption almost every first-time healthcare founder makes that you now know is completely wrong? Right? No, completely wrong. Right? So we'll start off again with Anas.
Okay. So I'm going to say what comes first to my mind. I think healthcare is a fairly complex ecosystem that monetization is such that what you have as a product is not may make money for you, where it fits in the ecosystem and how that downstream impact or the upstream impact of it will actually make more money. Now, what do I mean by that? We all think that, let's say you make a product X, you sell the product X, you'll actually make the monetization model. It fits purpose, product market fit. You tend to think of it that way. Instead, I think the learning has been, you look at the entire consumer journey and the ecosystem and ask, where do you do value capture? You may do a value capture. For example, we are in screening. We made more revenues as a result of partnering on the treatment side, where with the payers in the US, we were able to talk about reducing acute care costs. So your narrative is not about the device, but the outcomes of the device and downstream rather than upstream. Whereas in India, in the absence of a payer ecosystem or an insurance ecosystem, it's basically a narrative that has to be driven much more by what is going to be happening from the patient perspective. If, let us say, you're looking at a D2C model, or the B2B model, where what does it mean for the provider? So to a large extent, I think assumption made is because we are very close to product. And one of the advantages I always believe is have a sales and marketing person as a co-founder. If you are a product person, or if you are a sales and marketing person, have a product person. Defined roles, because you have to follow the ecosystem approach as opposed to and the consumer journey approach, as opposed to the product by itself.
on my end, I think when we launched the product, one of the assumptions was we are competing with Stryker, which is the fifth largest, in the world. And the thought process was that, if we sell an Indian product, the customers will not buy, surgeons will not buy. And to a point that, we have a US entity, and we thought, okay, वहाँ पर launch करके, we'll say made in Prudency Incorporation and not, Prudency Private Limited. And fortunately, my partner put his foot down and said, no, let's promote it as an Indian product. That was a very good decision to make. We promoted it as an Indian product, and to my surprise, incredible response from the surgeon, because what the surgeon wants is a value for money. What the surgeon wants is a better product. What the surgeon wants is his problem solved. And what the procurement guys want is a value for money savings, right? If we are able to understand and solve for these stakeholders independently and very precisely, I think it solves a problem, right? This thought process of US product is great and things like that. Having spent a lot of time in the US, I had that mindset, and I'm very happy that I don't have that mindset anymore. Very, very happy.
Oh, fair enough. Make in India, of course. That's fabulous. Yeah, please. Yeah.
Yeah, I have a slightly different take on this one. And when other health tech founders ask me, "What have you learned?" Because I'm a new health tech founder, right? I found with the couple of months and years that I've spent now with what I've been doing with health tech, I think the biggest conception with health tech today is that it's not a technology problem. Honestly, I think technology is the least of the problem. It's a user behavior change problem we have in technology. Whether it is the hospitals, whether it's the doctors, or it's the patients themselves, right? Whether it's B2B or B2C today, the biggest problem as a health tech founder that you have is user behavior change. It is something that we have to look at very seriously in India and figure out, if you want to be successful, how are we going to get the behavior change? You can have the best technology. There's so many great health tech products out there. The innovation is fantastic, whether it's medtech or health tech. The algos do a great job with or without Indian databases. So all of that is there. But if your product does not bring in the frictionless requirement that a clinician need, it doesn't fit into the clinical systems, it is not, doesn't bring in the longitudinal trust from the customer themselves, from the patients themselves, there is no hope on health that you will get adopted, right? So that is the biggest misconception, I think, about the healthcare ecosystem. It's the user behavior change that you need to factor in. And once you've factored that in, you suddenly start thinking differently, and your problem itself might be solved very differently.
Actually, it's very well said, right? There was this statement somebody had made that the best AI is where it's invisible. So you don't have to put the technology on the face of the user. If it is underneath, and they're more than happy to accept it. From our point of view, I think one of the things, or one of the biggest myths that at least I've seen a lot of us carry is that we'll get everything right on the first time. And every customer that you win will be there with you forever. I don't think either of that is true. When you're building something, you're making rapid changes. You're evolving, you're bringing in new use cases. Your system will be unstable. You, irrespective of how hard you try in terms of quality parameters, they will move. Right? And in that process, there will be customers whom you acquired would see you mutating towards, let's say, a larger picture or a different picture that they don't see to go along with. And you will have to make their choices, right? So you will have to choose sometimes to let go of customer. The customer will choose to let go of you, but I don't think that should be seen in a negative connotation. It should be seen in terms of the overarching goal that you're trying to deliver. And if that doesn't align with their commercial interest, then there would probably be discrepancies. So, but yeah, that's one thing.
Amazing. That'll be all from this panel for today afternoon. I think we'll give it back to the host, please. Round of applause for everyone, ladies and gentlemen, please. What an amazing panel this is.
Thank you, sir. Thank you so much. And now it's the time I request Mr. Raghu to kindly hand over the gift of honor to all our panelists and a moderator as well. So once again, ladies and gentlemen, let's give it up for all our esteemed panelists and a moderator as well. Let's give it up for Dr. Karan. Thank you. Thank you so much for keeping it very engaging. I request Karan also to kindly join along with Raghu to hand over the gifts to all our panelists. You can also join your hands to hand over the... All right, thank you so much. Once again, let's applaud for them, ladies and gentlemen. Thank you very much. I think everybody can come together for a group photo. Raghu? Yes. For the group photo, please. Yes, everybody together for the group photo. And then we can proceed for the next segment. So, well, once again, thank you so much for all of you. With that note, ladies and gentlemen, we move on to the next segment. We move to a session that brings the spirit of innovation, ambition, and entrepreneurship to the forefront. In the next few minutes, few hours,